Hello, we are starting with Chapter 17, Vital Signs, in your Fundamentals book. I'll let you look at how pretty that is for a little while, because that's really pretty. Really, really pretty. Okay, so there's 6 vital signs. As you see, there's the picmonic that goes with the vital signs if you like to get on picmonic, and if you are a visual learner, it's a pretty cool thing. So you have temperature, pulse, respirations, blood pressure, oxygen saturation, and pain. So the human body responds physiologically to all stimuli, both internal and external. External stimuli include air, sunshine, environmental temperature, sound, electricity, and any number of stimuli found outside the body itself. Internal stimuli include the pH, hormones, enzymes, electrical conduction of impulses along nerve pathways, and gases. So one of the basic ways to determine how a patient's body is physiologically responding is to assess their vital signs. Vital signs are extremely important. You will have to know for your test all the normals with the vital signs. Okay, so what's normal in temperature, what's normal in pulse, what's normal in respirations, what's normal in blood pressure, and so forth and so on. Vital signs are a quick and efficient way to monitor a patient's physiological condition, identify new problems, and determine if an intervention should be performed or if a prior intervention was effective. So this is just a box that's in your book talking about when to assess vital signs. You pretty much assess vital signs very frequently as a nurse. On admission to the hospital, each visit to the clinic or emergency room, at each home health or hospice visit. So, I mean, you're going to be a master at vital signs before you are finished with nursing school, because you will just be doing a lot of vital signs. Note in this particular box, you're going to assess vital signs before, during, and after blood product transfusion. So if you have to have a blood transfusion, you're going to be doing vital signs before, during, and after it's completed. Very, very, very frequent assessment when someone is getting blood. These are scales of temperature measurement. There is a Fahrenheit to Celsius conversion formula that is in your book that you can use. Also put a video on your pharmacology on going from Fahrenheit to Celsius and back and forth. But this was just a cool little picture that kind of shows you what it looks like. But you can do it the way your book says to do it, or you can do it the way the video says to do it, as long as you can get from Fahrenheit to Celsius and Celsius to Fahrenheit. So thermogenesis. This is the production of heat. Thermo means heat, genesis means begin. So body temperature is the difference between the amount of heat the body produces and the amount of heat that is gained or lost to the external environment. The core temperature, which is the temperature of the deeper structures and tissues, is normally slightly warmer than that of the more superficial body tissues. So the core temperature is actually measured by it's deep, so it has to go either into the brain, the internal organs. Measurement of the true core temperature is accomplished with a sterile thermometer probe inserted into the pulmonary artery, heart, or urinary bladder. So one of the ways the human body produces heat is through the processes occurring after the ingestion of food. It increases your metabolism and it causes your temperature to rise. Now, thermoregulation, or the regulation of body temperature, is primarily controlled by the part of the brain known as the hypothalamus. When the hypothalamus functions correctly, it maintains a comfortable core temperature known as the set point. So that's the difference between thermogenesis and thermoregulation. Now, different things will affect the body temperature in different ways. Environment. If it's hot outside, your body temperature is going to be higher. If it's cold outside, your body temperature is going to be lower. The body has a time clock or a rhythm of its own known as the circadian rhythm. So your body temperature will actually drop 0.5 degrees Fahrenheit to 1 degree Fahrenheit lower between midnight and dawn and raise 1 degree Fahrenheit to 2 degrees Fahrenheit in the late afternoon and evening. This explains why children always seem to get sicker after the typical healthcare provider's office closes in the afternoon. Gender, there's only slight differences related to gender. Physical activity and exercise. When you are using your muscles require fuel in the form of glucose to metabolize or burn for energy. So your metabolism is going to be higher, therefore your body's temperature is going to be higher. When you're inactive, it's going to be lower. Some medications will increase or lower your temperature. Tylenol, ibuprofen, all those will decrease your temperature. Stimulants such as ephedrine increase the body's metabolism, thus increasing the body temperature. Food intake, again, because calories are burned, providing fuel for metabolism, the amount, type, or lack of food ingested can directly affect the body temperature. Stress. Okay, so individuals who are anxious or stressed may tend to have a slightly higher body temperature due to the stimulation of the sympathetic nervous system. Hence, when you get nervous, when you get stressed, you start sweating under your arms, under your nose, so forth. And of course, illness. So there's different routes of temperature assessment, of course. The core body temperature is the most correct, but you can take it orally, axillary, which means under the arm, tympanic, which means in the ear, skin, rectally, and also the temporal artery. So, but the rectal route is not the route that you really want to use just because of the risk of intestinal perforation. You don't want to put a hole in their intestine with that. So, and especially if a patient is having diarrhea, you're definitely not going to use the rectal route. These are normal temperature equivalents by site. So febrile means fever. Afebrile means no fever. So febrile is used to indicate the state of having a fever. Hyperthermia is more commonly used to describe serious elevations above 105 degrees Fahrenheit. So these are signs and symptoms of a fever: flushed face, dry hot skin, dry mucous membranes, elevated pulse rate and rapid respirations, thirst, and so on. Here's just some more. So the opposite of hyperthermia is hypothermia, which means the core temperature is below 95 degrees Fahrenheit or 30 degrees Celsius. This slows the body's metabolism. Sometimes it has to be induced deliberately to reduce the body's need for oxygen during neurological or cardiac surgeries. Prolonged or severe periods of hypothermia can result in death. Y'all know I love Jason Momoa. So when we're talking about checking the pulse, this is just a picture of the anatomical chest, okay? So you'll see the clavicle, you'll see the mid-sternal line, the mid-clavicular line, and it shows you where you're going to check the apical pulse before the age of 4 and where you're going to check the apical pulse in an adult. So if you are listening to the apical pulse but detect a different rate in the radial or brachial artery, ask another nurse to count the radial artery, the radial pulse, while you are counting the apical at the same time. Also, there is a disease called congestive heart failure. This means this is actually a disease where the heart muscle is weak or damaged and unable to be strong enough to move the blood to where it is supposed to go. This means the patient will have a decreased cardiac output. So there's not a lot of blood flowing out of the heart. These are different peripheral pulse sites. You have your temporal, you have your carotid, you have your apical, brachial, radial, femoral, popliteal, posterior tibialis, and dorsalis pedis. And when we're in the lab, we will go through all those as well. So as a nurse, you will assess 3 different characteristics of a pulse. The rate. So the rate, the normal range of pulse rate for adults is 60 to 100. A pulse less than 60 is known as bradycardia. A pulse greater than 100 beats per minute is termed tachycardia. Numerous factors can affect the pulse rate. If a pulse is not detectable by palpation, it is termed absent or rated as a 0. If this occurs, your next step is to palpate for the next proximal or closest pulse in that extremity. So also the rhythm can be off. Like it should go dump, 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 dump. And if it don't, it could be dump, dump, da 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 dump, dump. So that would be an irregular rhythm. So the more fluid volume in your system, the pulse will be more full and bounding. And the less fluid volume, the pulse will be weak and thready. Now, respiration. This is the interchange of oxygen and carbon dioxide between the atmosphere and the body. It involves both external respiration and internal respiration. So basically, this is breathing in and breathing out. The rates per minute. The normal rates for adults is between 12 and 20. Each respiration consists of 1 inspiration, which it means breathing in, and 1 expiration, which means breathing out. When the rate, depth, rhythm, pattern, and respiratory effort fall within normal parameters, the term eupnea is used to describe the respirations. Bradypnea means that the respiratory rate is below 12, and tachypnea is when it is greater than 20. There is a table 17.5. And it gives you further factors that affect the respiratory rate. I want you to focus on what makes the respirations decrease. There is also a table 17.6. You need to know these patterns and what they mean. So there's things called adventitious breath sounds. That means that it's not normal. So you may hear wheezes. These are musical whistling sounds. You may hear crackles or rails. These are short, choppy, popping, snapping, or raspy sounds that may resemble the sound made by rubbing strands of hair between your thumb and index finger. Ronchi are continuous low-pitched rattling or bubbling, snoring, or sonorous wheezing sounds that may be oscillated when there is a partial obstruction. Stridor, this is an emergency. Stridor is an audible, high-pitched crowing sound that results from partial obstruction of the airways. I would also suggest you go on YouTube or wherever and look up videos to hear these different sounds, because it's going to help you to understand better what is normal and what is not. There are 4 circulatory qualities of blood pressure: strength of the heart, blood viscosity, blood volume, and peripheral vascular resistance. So your blood pressure is the measurement of the pressure or tension of the blood pushing against the walls of the arteries in the vascular system, not the veins, not the capillaries, but the arteries. The amount of pressure is determined by a combination of these 4 qualities of blood pressure that we just mentioned. These are factors that affect blood pressure. Age. Usually the blood pressure gradually increases throughout the lifespan. Hypertension tends to have a higher incidence in African Americans, especially males. Rest, medications, obesity. Blood pressure is usually higher in overweight and obese individuals. And hemorrhage, loss of volume, will actually lower the blood pressure. On the opposite, if the patient has too much blood or too much fluid, the blood pressure will be high. So these are components of blood pressure reading. Systolic is the first sound. Diastolic is the second sound. Pulse pressure is the measurement of the difference between the systolic and diastolic pressures. So you subtract the smaller number, the diastolic, from the larger number, the systolic, and that normally is between 30 and 50. If it's less than 30 or greater than 50, then that is considered abnormal. And then hypertension. Hypertension is the term used to describe a systolic reading consistently above 130 or a diastolic reading consistently over 80. So here's a picture of a stethoscope. So there is a bell and there is a diaphragm of the stethoscope. As you can tell. So when you're checking blood pressure, the first sound, well, so these 5 sounds are what we refer to as Korotkoff sounds. The first sound is the clear, rhythmic tapping sound gradually increasing in intensity. That's going to be your systolic number. The second sound is the soft swishing or murmuring sound representing turbulent blood flow. The third sound is a sharper, crisper, rhythmic sound. The fourth sound is softening or muffling of the rhythmic sound. And the fifth sound is silence. So the first sound is your systolic. The fifth sound is your diastolic. So talking about hypertension, you may have primary or secondary hypertension. Primary is basically, it's also called essential hypertension. Secondary is when there is renal or endocrine disease process that results in the elevation of the blood pressure. Treatment of hypertension, usually you're going to be educating your patients on reducing their dietary intake of salt and fat, reducing their weight, stopping smoking, reducing alcohol intake, stress reduction, increase of physical activity and exercise, and sometimes medications. When left untreated, hypertension can result in permanent damage to the brain, the heart, the kidneys, and the retinas of the eyes. Hypotension is when the blood pressure suddenly falls 20 millimeters of mercury to 30 millimeters of mercury below the patient's normal blood pressure. It falls below the normal of 100 over 60 millimeters. Oxygen saturation. This is also known as SpO2 or O2 sat. Oxygen saturation. So 96 to 100% of hemoglobin is bound with oxygen molecules. We check this by using an electronic pulse oximeter. And by the way, it's oxygen saturation or O2 sat, not O2 stat. Please don't ever let me hear you say O2 stat. Pain is also part of the vital sign assessment. And there's more than just, are you having any pain? You need to know where the pain is, what the location is. What's the characteristics? Is it sharp? Is it dull? Is it cramping? Is it burning? And you're always going to use a pain scale of 0 to 10, unless the patient cannot talk or if it's an infant. So in those specific cases, you will use the FACES or the Wong's pain scale. But a pain scale 0 to 10, you'll ask the patient from 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt, what is your pain level? And they may say 10, they may say 20, they may say 0, but that's what you put. Pain is what the patient says that it is. This is just a little picture of documenting vital signs. It's kind of cool to just kind of watch that as well. Okay, which of these peripheral pulse sites is used to determine circulation to the foot? The answer is dorsalis pedis. Radial and brachial is in the arm. The carotid is in the neck. The measurement of the force exerted by the blood against the walls of arteries during contraction of the ventricles is known as? The correct answer is A, systolic pressure. And that is all for Chapter 17. Let me know if you have any questions.